Hello, we are the Association for Child and Adolescent Mental Health, or ACAM for short.
Hi everybody, I'm Jan Forshaw, Head of Education at Quorum Local Education, and we work with ACAM to bring these series to you. We support ACAM in doing that. I'm also joined by my colleague Jo Gray, who's going to be feeding questions through. And just a reminder of what Matt said, which is if you could try and put your questions onto the Q&A function on the tab at the bottom of your toolbar there. It's usually at the bottom anyway, so I hope it is for you too. Questions that get put in the chat can get a bit lost, so just worthwhile remembering that. Also, just great to see so many people from such a huge range of places across the UK and beyond. I saw somebody joining us from India, some people from Ireland, so really great to have you here this evening. Before we start formally and before I introduce Tina, just to say that we will be having, we'll have Tina's session and then we will have a formal Q&A session at the end of that. And we find it's really helpful if people use the time when Tina's doing her presentation to just really focus on that. If you have questions, maybe save them until the Q&A time so that you can really give that the full attention. Okay, so let's get started. And Tina Ray, many of you I know will know Tina. We welcome her back to ACAM. She's done presentations for us before and really welcome. So a little bit about Tina Ray first. Dr. Tina Ray, she's got 40 years experience working with children, adults and families in clinical and educational contexts and within local authorities and specialist services. She's currently working as a consultant educational and child psychologist in a range of SEMH and mainstream contexts and for fostering agencies, and as a consultant psychologist supporting foster carers, social workers and looked after children. She was an academic professional tutor for the Director in Education of Child Psychology at the University of East London from 2010 to 2016. And she's a registered member of the Health and Care Professions Council and a member of the ENSEC, which is the European Network for Social and Emotional Competence, and a former trustee of Nurture UK. She's a member of a number of editorial boards, including the International Journal of Nurture and Education, and a member of the advisory board for Fresh Start in Education, and of course, for our very own ACAM, where she's been here supporting us for a number of years. She's a prolific author, as I think many of you will know, and has over 100 publications to date, and these reflect her ongoing passion for developing practical resources for schools which have an evidence base and enable practitioners to ethically deliver effective preventive mental health intervention in schools. And that, of course, is why we're here tonight, isn't it? It's so valuable for us to have Tina with us this evening. We'll hear more about also later about Tina's soon to be published new book about supporting refugee children, so more on that later. So with that, I would just like to say thank you so much, Tina. It's great to have you with us again. Many people will be having a repeat of your session, or rather repeat of an input from you, because you did a superb session about a year ago, actually, about refugee children and supporting refugee children. So thank you very much for joining us again, and over to you.
Thank you. Thanks very much. Right, I'm just trying to get these slides to go through here. I don't know if I'm onto they should be going. Here we go. Right. Thanks very much indeed for that intro. Right, okay, today's learning objectives. I'm going to actually think very much in this short session, because it is short, so it's a kind of whistle-stop tour, but I'm hoping that there will be some really good golden nuggets here that you can take away and that will really make you think about your practice, your understanding of this area. Because what's really crucial is that we understand more fully, how to support children, young people who are experiencing grief, loss and bereavement in our schools. So I'm going to think about some of the current issues, the context that we currently find ourselves with and how that's impacting upon children, young people. And I want to challenge some of the common myths and grief models, which are very prevalent still, because I want to be thinking much more about a richer understanding of behaviours linked to these key areas of bereavement and loss. And also think about equipping teachers and those who work directly in schools with children and young people, some key tools and techniques for helping them to navigate this process. I know that this poll is being conducted as we speak, as I speak. Which type of school are you representing this evening? And I think that will be very helpful information to be able to share with you as we go through. Okay, now this seems a little stuck again. Not quite sure why this isn't allowing me to move on. There you go. Okay. So, grief and loss. This is a topic dear to my heart, something I feel very passionate about, having worked in the area of social, emotional, mental health for many, many years, and working with children and young people, very often given some kind of diagnosis of a mental health condition or of a behavioural issue or difficulty, and not actually having what was underlying that really identified, which is that they were bereaved, that they were experiencing the loss of someone very, very close to them who had nurtured them and looked after them for their short childhood or for many more years. So this loss of someone significant to us, it's really one of the most intensely painful experiences that any of us can suffer. And we know this, but what's equally as debilitating and awful to observe is someone going through this process. It's so painful because actually to all of us when we are bereaved, the only thing that can really comfort us is that person returning to us, sadly. And this is from Bowlby's seminal work in 1988, Love, Sadness and Depression. My perspective at the moment, we are dealing with an increasing number of children and young people who are experiencing some form of loss. And the current context in which we know COVID is still pretty prevalent, it's around us. Thankfully, it's not having the same impact in terms of the number of deaths currently. But for our children and young people, the last 3 years have entailed a great deal of loss in many, many different areas. I think it's very important that we recognise this and we think about loss in a broader context, in a broader way, because it's not just about losing someone through death, but it's about losing the loss of all of those different things, all of those different opportunities to play, to socialise, the rites of passage, to learn, to be creative, to take exercise, just having fun and relaxing, and access particularly to resources. These are losses for the majority of our children that they will have experienced during the lockdowns and post-lockdown to some extent or to a greater extent. And what I'm very concerned about are the most vulnerable groups of children, those with special educational needs, those who have already pre-COVID pandemic were experiencing mental health difficulties, difficulties in going into school, emotionally based school avoidance, for example, missing the kind of nurture, safety and opportunities for co-regulation with supportive and nurturing adults. What I do think we have to be careful of here, however, is labelling this whole generation as the lost COVID generation. I think we must look at this on a continuum. There are those children who were more resilient, those children who were less resilient, and that will mean a much more bespoke approach to different groups and individuals in our school context. What more children than ever will probably have experienced during the last 3 years is a loss of someone due to COVID, sadly. Generally, this will have been someone older, but someone who maybe they would not have expected to lose at quite such an early age. So losing your grandmother, using your grandfather, your older auntie, someone who's nurtured and looked after you. And I think the impact on some of our younger children in particular has been pretty significant. When we're thinking about explaining to children and young people, this is a key area for me as an educational and child psychologist, something that I always talk about developing scripts, writing your scripts, because I talk to teachers a lot who say, well, I don't know quite how to approach this. Early years teachers, those who work with children in nursery reception to Key Stage 1, at the bottom end of Key Stage 2, for example, will probably be making use of a lot of literature. There is so much out there that we can access now in terms of stories that allow you safely and therapeutically to explore these issues. But it's interesting, when we stop and actually say to each other, how would you explain death to a preschool child, a primary age child, a teenager? How would you define this? You need to be able to know what their understanding might be, cognitively. You need to understand what they can cope with and what they experience emotionally, and what they are at in terms of their developmental stage. So there's quite a lot of unpicking to do and information gathering that we need to do as practitioners working in schools directly with children and young people. I think we need to watch our language. We need to be very clear that it's age appropriate. We need to also think about the child's belief system as a starting point. But when you stop to actually engage in this activity, and I hope people will take this away subsequent to this session, if you're working in a school, and think about what it is, what would your script be? I also think we need to understand loss in its wider context, as I said previously. And at the moment, because of the post-COVID pandemic issues and also the ongoing issues that we're having currently in terms of people's financial situations, there is a lot of loss that's going on that maybe we would not have been so aware of previously. This financial anxiety parents are experiencing, the choosing between heating your home, buying your food, children recognizing the level of panic for some of their parents as to how they're going to pay the mortgage, how they're going to pay the bills, cancelling special plans and events because we can't afford it anymore, etc. In COVID times, of course, it was around social distancing, feeling really a sense of isolation, not being able to engage socially with those that we love in the same way. I also think now that there is an ongoing sadness for many as to the impact that the pandemic in particular had on the world, but also we now are experiencing and being made aware of on a daily basis the issues around the ongoing war in Ukraine and wars, of course, in other areas of the world. So these are types of loss that will engender this kind of grief. What we have to do, and what's so important for all of us, adults and children alike, is ensure that we actually make the time to grieve. This is so, so important. When we have lost someone, this psychological impact is really significant. We feel totally depleted. And I think what we long for is the past. We want it to be back to where it was before. I want to be able to play with my friends again. I want my mummy back again. I want to be able to sit on her lap. I want my best friend back again. I want us to be able to go out and have that glass of wine and chat together and tell each other our worries and talk about the lovely times. Mourning is important. It's an important part of the human existence. We need to do this to bear witness to our loss, to feel sadness, anger, guilt, all those big emotions, and process those, hopefully, with a significant other, a friend, or in some instance, when it's more complex grief, an adult. And also acknowledge that what we've lost was something that we loved, whether that's a human being, or whether that is a singing voice, for example, whether that is the ability to use your hand properly because you've got carpal tunnel or something else. There are lots of ways that we experience this loss, and we need to acknowledge it and share it with others. What is also something that I think we are experiencing more, or have done as a result of the pandemic, are these unexpected losses, when people died very, very suddenly. And this can either be through, sadly, by suicide, or it can be through the COVID pandemic, through actually getting the virus and being very, very ill due to additional health needs. But this is important because during the pandemic, for example, we could not do what we would normally do, which is access support from our immediate group. We couldn't turn to one another. We couldn't cry together. We couldn't be in the family together. I had to witness 2 of my loved ones' funerals online and couldn't be there to embrace my sister-in-laws, etc. So I think for many of us, there will be a personal resonance about what I'm talking about here. Many of us have experienced this firsthand. So it's made it much more difficult, I think, to cope and to actually go through the usual process. What we experience when we grieve is that trouble in focusing, in attention, in concentration. We sleep, some of us, much more or less than usual, and we can show flashes of anger and irritability much, much more quickly. For some, there will be psychosomatic or headaches, upset stomachs, etc., or a sense of just feeling fatigue, which we may associate with feeling depressed also. And for others, there will be this re-experiencing of feelings of past grief when we have lost someone, and it re-triggers that loss. The connections are made. Sometimes we will engage as adults, particularly in other activities such as eating more excessively, drinking, online shopping, in order to cope with that anxiety and distract ourselves. And avoiding thinking about or talking about the loss, the pandemic, the war, whatever it is that we're experiencing in terms of our grief at this current time is also fairly typical in terms of a sign of grief. I have to say this is not all doom and gloom, however, but because we know from the research, we particularly know from research around resilience and post-traumatic growth, that we do actually have some level of resilience in the face of our grief. And once this immediate crisis is past, most of us, when this grief is not complex and not based within this huge amount of trauma, and so I'm making a distinction here between those children who've experienced a traumatic loss, such as our Ukrainian refugees coming in, some of our children who have lost families through violence in the home, etc. But the normal process of grieving, where we do come to a place of acceptance, and we can adapt, we can learn to live with the pain of that loss and grow around it. What's important to remember, however, is that those experiences that some do not regard as grief worthy need to be maybe rethought about a wee bit, because they activate emotional responses very similar to the emotional responses we will get when we are grieving a loved one. So death is that conspicuous loss. And if a death doesn't occur and the loss is about something else, then we have a tendency sometimes to dismiss that. And we dismiss what we feel because we don't think that we're actually entitled to grieve or mourn that misfortune. And I think that's a problem, because grief does occur in many forms. We grieve because we remember when things were different. When we perceive our former circumstances were better than they are now. So think primarily, I think very saliently now, about our refugee children, young people. They will be grieving for the way it was, just as we will be grieving for the way it was if we have lost someone or something significant to us. Many years at the start of my career, which obviously is now obviously quite a long one, I had many conversations with people who just felt that children weren't old enough to experience grief and we should protect them from it. We shouldn't be talking to them about it too much because we didn't want to traumatize them or push our own grief, our own feelings of loss onto them. This is an excerpt from David Kessler's website on grief and grieving. And he said, yes, of course, if children are old enough to love, they are old enough to grieve. And I think this is important to know. There is a case here to be made that for many of our children, young people, particularly those in the early years, people tend to kind of dismiss that slightly and say, you know, they're not going to grieve in the same way. Now, no, they're not going to grieve in the same way, but they are going to experience grief and loss, and it will show itself, manifest itself maybe in different ways to the grief that we would feel and experience. What's also important, I think, is the surviving parent or carer. I think it's really vital to remember that children who have a bereavement and have lost a parent or a key carer in their lives will be relying on someone else to support and nurture them, but that person may also be experiencing grief. And this, I think, is also where school-based staff and practitioners come in terms of actually providing more bespoke support for those families experiencing grief, not just for the child. If we focus now on the child, however, because I think this is obviously what this session is primarily about. We could have another session on supporting parents, obviously. I think this is important. What we need to look for, what might we see if the child is experiencing grief? So we would experience, I think, a proper view of them in terms of looking at social isolation, separation anxiety. Some children will be reluctant to leave home. They will not want to leave that situation just in case they may lose the other parent, the other carer. There may be fears around that. We might get some separation anxiety resulting, or emotionally based school avoidance because they want to remain safe at home and they fear being away from the family that they still have left. We might experience some friendship difficulties, as with adults, wanting not to be with people, more anger, physical symptoms, again, headaches, stomach aches, very common. And also a fluctuation of mood. And I think this can be quite tricky for some people to handle. I call it puddle jumping. So for children, younger children in particular, one moment they may be sitting in the calm corner or just very quiet at the back of the class and feeling very down and upset and very teary, and then the next minute they can be talking about you know, next week, you know, I hope we're still going to go to Disney World. I know that mummy died, but we are still going to have a holiday, aren't we? And then they may go out into the playground and play with their friends, seemingly quite happily. And I think sometimes for adults, that's quite hard to navigate, because our grief is kind of just here within the pit of our stomachs, and we are very aware of it all the time. And I think that we kind of expect children to experience it in the same way. And many younger children will do this thing. They will puddle jump, and we have to be used to that and not get kind of phased by it in any sense. Sleep problems, reduced concentration, and some kind of developmental regression, so bedwetting or loss of skills, particularly in the classroom. Their reading may deteriorate, loss of skills in terms of being able to look after themselves, self-care, etc. And that is all quite normal for children at this stage. So to start with, what we have to do always, 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 in my view, is normalise the feelings for the child. These are things that you experience. It's normal for all of us to experience these things when we are grieving, when we've lost somebody or something that we love. And I think that's very, very important, because very often children and young people may feel very isolated on their own, as if they've got to deal with this on their own. But also they will be experiencing, perhaps some of them, this whole sense, this whole experience of loss, which can be very, very overwhelming. So simply being able to recognise that, affirming this, saying that this is okay, this is what we would expect, is really, really helpful at the outset. Also, I think we have to understand, as I said earlier, the grieving process itself. And I think this notion of the linear model, Kubler-Ross, for example, that we go through shock, disbelief, denial, that we protest at the pain of separation, which is where some of the behavioural issues may occur for children and young people. Then we feel guilt, anger, depression. The last thing I may have said to my mother before she died is something not very pleasant, or I may feel guilty about some of the things I didn't do for her. Or I may have been horrible to my dad when he didn't let me go to the party when I was 16, 17, and I said something horrible. Maybe I will feel guilty because I might think I'm the cause of this, because I said something horrible, like, I wish you were dead, Dad. And of course, then that did happen. And I think this is really, really important. The guilt, anger, depression, again, all normal, and also all need to be talked about. Talking is the key here in a therapeutic, nurturing, safe context. And then acceptance, adjustment to the new life without your loved one, gradually over time. However, I don't think grief is linear at all. And I think this is really difficult, because if we go down that route and we adopt that model and it doesn't occur in that linear process, this can be quite traumatic, particularly for our children and young people. It doesn't just start strong and then taper off. It's really like a storm. It grows smaller and larger in the same day, and often within hours. So, you know, it's much, much more fluctuating than that. I think we want it to work in a linear way. I think that makes us feel more autonomous, that we can manage it more effectively. But actually, grief works really, really messily. And we go backwards and forwards in those stages. One day I may be very, very angry, and the next day I might have come to a place of acceptance, but then the following day something triggers in my mind, something brings back a memory, and the grief starts all over again. I like Tompkins' model of grief. There is a reference to this at the end of the presentation, because this for me seems more logical. Think of it starting off very, very big, but then I grow around it. So that ball in the jam jar there is my grief. And over time, what happens is I grow around it. The jar seems to get bigger. And I learn to live with the pain of the loss. But the pain doesn't go away. And of course, invariably, I do think there's a case for this, that when that love is so intense and so great, you have to remember, of course, your pain is going to be so great too. But over time, we grow around it. And for children, I think we have to remember that there are key factors that will affect their grief, their age and development of thinking skills. So younger children don't really understand the finality of death. So this is where your script is important as well. Also, language skills. How much can I express? How much can I talk about this? What is my receptive, expressive language like? How much can I actually really understand? The quality of support, again, crucial here. I worked in an SEM context in an outer London borough for 6 years. And this is a school for boys mainly, 6 girls actually at the time I was there, with social, emotional, mental health needs. And the quality of support was absolutely essential in terms of giving them the kind of nurture and the therapeutic conversations that they needed at the time, all the way through actually their school careers, but also in terms of thinking about their loss, because we did a survey of the school and looked at their early years and looked at what had happened to them in their early years, and found out that for the majority of these children, they had experienced a loss when they were very small, usually a granny or an auntie who was caring for them because their parents' carers were not available or they'd been fostered due to drug, alcohol issues, etc. But it was so significant. None of these children were given any support for this loss. When they talked to us, that was one of the things that they said. No one talked to me about it. It was brushed under the carpet. I wasn't included. Also, the context of loss or nature of death. If it's a death by suicide, that child is going to need a significant level of support. And this will be very different, but the context is important. Was it violent death? Was it something that they witnessed? There are lots of things to remember here. Degree of attachment. How attached were they to that caregiver that they lost? And the information made available. Not giving children the right information at the right time, in my view, can be very, very damaging. And also not telling the truth. And I say truth advisedly, but actually not telling children what is really happening can be very damaging, because actually they don't know then who they can trust. And I think that's very, very important. The control over events as well. I will feel more in control if I am included in the conversations and you meet me at my developmental level to explain what has happened to me. And responding to questions that children have is also absolutely essential. We don't rush them aside. We must use language that they understand and be literal. Avoiding terms like he passed away, he died, and they must understand what that means, okay? A wee boy that I worked with many years ago was told that his mummy had gone to sleep. What happened was that he then developed a sleeping disorder because he was so frightened to go to sleep in case he also died in his sleep, and he was worried about other family members going to sleep, going to bed. This became a huge issue, and that's very important that we are literal. Also, to avoid being shocked by this kind of blunt inquiry that kids give us. So one little boy once said to me, do people still poo in heaven? And, you know, tongue in cheek, I can say it's quite tricky to answer that because I'm not sure about heaven, but I think we have to be aware of these questions, and children aren't doing this other than not to shock us or anything else. They're doing it simply because they need to know. And again, don't be avoid being surprised by this puddle jumping, moving from one mood to the other, and obviously sensitive to different spiritual beliefs. The key thing that I think we can all do in a school context: helping children to express their feelings, making time to talk, giving that quiet space, just simply listening, active listening, sharing our feelings, normalizing it. Yes, I can understand that, without too much self-disclosure, which can be very tricky and unadvised in my view. But being honest, providing routine and support is also absolutely essential. When this kind of event has happened for a child, just as I think for our refugee children and young people, getting back into a school context, going through the different routines, it's just the same as us getting back to work and trying just to do my daily job, helped me significantly after my loss. And I think it's absolutely no different for children and young people. However, they may need some additional resources, some additional time out, some additional time with that therapeutic adult. Involving children in funerals and ceremonies, again, not lying to them about this. They need to be part of this process as far as they want to and as far as they need to. Very important. Providing opportunities to remember, to celebrate, to talk about our loved ones. And also I think this key here is about patience. Things don't suddenly get okay overnight. We will have to be patient when the child, for example, does regress, does find it more difficult to socialise, does lash out, does become angry, shows a greater level of anxiety. Very important, we are patient, we are nurturing, we are understanding. This is a moral imperative in my view, and involving family and friends too, absolutely essential. So some of the key things that I make use of in my work, and I just have found this in school when working with a child, particularly when I'm working with some of the ELSAs, the TAs that I train up, who actually take on this therapeutic role. Very, very important. Memory boxes and books. So that special box where you can put some of those possessions, some of those things that you remember, so that when you do feel that you're really missing your loved one, you can pull them out and reflect through them and remember some of the wonderful times, some of the good times that you've had, some of the things that made you feel special and love them so very much. From my bereavement book, this is another activity, just taking some time to reflect upon this memory in my palm. So just a very simple activity. Imagine you're holding that perfect memory in the palm of your hand. What would it be? And there is a format then that the child, the young person, can make use of. From the bereavement box from the charity Nurture UK, this is an understanding activity. So thinking about how we do get worries, we do worry about our special person. We need to talk to someone. So children can create a worry jar, writing down worries, placing them in the jar. Then they can talk about them with that trusted adult or special person later. Sometimes I think this can be really, really helpful in the context of a busy classroom, a busy school day, just jotting those down. You might have a worry book instead, or a worry notepad. Visiting the grave, sharing in these rituals, again, very, very important for our children and young people. And this, of course, is going to be different culturally in different cultures. Obviously, it will be. But for me, this is something that I would highlight, not allowing children or enabling them to do this, to tell them their news, to think about how they're feeling, to talk about their sadness, showing their love through flowers or other small gifts or tokens can be very cathartic, therapeutic. Another key seminal way in which we can do this is by planting trees and shrubs. Some people like to do this in a school context, for special members of staff, for example. I have 3 rose trees in my garden for my mum. And I also have an orange tree for my dad in Greece, where his ashes are planted. And this is important for someone like me who wants to go and actually commemorate, to remember, to just have a place of peace and quiet to think about and reflect upon that person. For children and young people, creating artwork can be really, really helpful, therapeutic, and a safe way to pour out the way in which we feel about someone. And also making something beautiful for the person that we've lost, for example, can be a way to celebrate them and something that they can treasure in the future. Candles go across cultures, in my view, saying that special prayer or that special memory, or writing a poem on the anniversary or at other times when we want to remember and celebrate our loved ones. Another one from the bereavement box around remembering. What are the feelings and memories inside my heart which hurt? Because it's not always good. It's not always something that we find a pleasure to experience. It can be very, very difficult. What are the most special? What are the ones that I can relive again when I'm feeling sad, when I'm feeling that level of hurt, that level of despair again? Because all of these are okay. And I think that's a strong, important message to give to children and young people. All your feelings are okay. They're all valid. Diaries, journaling. For me, this is something I do practice, I use on a daily basis. I think it's also really, really helpful to think about looking back, referencing some of those lovely times that we had with our loved ones, but also processing our feelings a wee bit more. And obviously, this is for children, young people who are able to do this in terms of writing, drawing, reading. Their basic literacy skills need to be at a certain level, but not necessarily at a level where they're going to actually journal and write pages and pages. I think we need to be clear about that. This can be something that can be differentiated quite easily for children and young people. Some children just sketch, write out, or draw out memories. It can also, I think, help us when we look back, and we can unpick some of those maybe knotty situations or feelings that we've got ourselves into, some of the things that we need to go and talk to someone else about. So that can be helpful. But also we can look back at some of the good times, knowing that we can and may and will experience those again. Normalising sadness, again, rainy days happen, normalising those and remembering when we do feel sad, who is it that we can go to? Who is it that we can go and talk to? So recognising who those people are in the home and in the school context, because sometimes it just needs to be 10 minutes sitting next to, alongside that adult who can really listen. And the moment I start to share my grief, they're not going to solve it, they're not going to take it away, but they're going to normalise it for me. And those fears and those big feelings will suddenly become less big and fearful, simply through the act of talking it out. I want to flag up this resource, obviously, because this is something that I produced for the charity. So it's not something, obviously, I'm benefiting from in terms of financial. I do say this because, hand on heart, I really, I'm very passionate about Nurture in schools. And a lot of this work I've done is in terms of Nurture UK and developing nurture provisions in schools. And this is something in which many of the bereaved children and young people can really access the kind of support that they need. So very useful in 3 sections. 20 cards per section of understanding, really understanding the nature of death, its permanent, the grief process, etc. And then remembering activities, celebrating activities. And again, this resource very, very similar in terms of providing lots of activities for understanding, expressing and processing grief and loss, but also in terms of the appendices. I think this is really important, developing a grief management, bereavement policy, lots of ideas about supporting children and young people and parents and carers, and also a focus on suicide and I think complex grief as well. So at the top end of the continuum, some resources there to support you with that process of supporting those with complex grief. And what I mean by that, obviously, suicide, murder, COVID, accidental death and war, because we know that the symptoms of post-trauma stress will be the re-experiencing, the avoidance, the arousal. And my new resource for refugee children and young people really has a wealth of evidence-based resources, ideas and strategies around supporting children to engage in post-trauma activities, which really will lessen that stress and support the healing process over time. What we have to be aware of all the time, in my view as well, is to recognise those at what I call the top end of the continuum. There will be a need for outside support, clinical support for those who pretend on an ongoing basis nothing's happened, go into total denial. Their schoolwork takes a huge dip. They're at risk of developing EBSA or do develop emotionally based school avoidance. They threaten suicide. They have more frequent panic attacks. If they become involved with alcohol, drugs, if they begin committing serious crime. And I think as well, if the young person was not told about this loss for a long time, or if they were told lies about the death, the anger associated with that, the physical assaults that they may then conduct on others, or the cruelty to animals, if they have difficult relationship with the deceased and behave poorly with other family members, this is something else that could lead to more complex grief, particularly if that relationship was one that was very, very abusive. And also if the young person maintains this unwillingness to socialise or inability to socialise appropriately with other young people. If these issues escalate, if these areas are something of real concern, then my suggestion here very much is that you seek that clinical support. And although our CAM services are hugely oversubscribed, we know this, there's no denying that. Many of these services now, in my experience, are offering telephone consultations in the first instance. So I think it's well worth actually accessing that. And also your educational and psychologists. Primarily, I know that lots of these services are still doing lots and lots of statutory work. However, this is something I think we need to be flagging up now for the role of the educational and child psychologist, who has a wealth of skills in this particular area in terms of supporting you to support children and young people with loss. Why is the counselling, why is that additional support so important at the top end? Children and young people need to process these feelings in order to move on in a healthy way. And if we don't explore these frightening, overwhelming feelings, then we don't make sense of them. And children can become depressed or stuck with these angry feelings, stuck with this complex grief. Okay, and I think that's really important because they may find any future bereavement really traumatic, and also they may find it hard to trust loving somebody because they are so afraid of losing them. So they will cut off from their feelings in order to prevent more pain. So this warm, empathic, caring relationship with a therapeutic adult or counsellor is very, very important. We need to give them the gift of daring to feel love again. So it's really, really important. We observe, we remain in a position of watchful waiting if that referral needs to be made. In a school context, there's a lot we can do in terms of this mentor quiet space, providing bespoke smaller grief groups. I think in Scotland they are doing lots and lots of work around these grief groups, and I think that's something maybe people will want to consider. I also think in the school curriculum resources, what have we got available? There's so much out there. I also think protocols for reintegration, and in my book I have a very clear policy on this and how to go about that in terms of bereavement policy too. There may be some issues I think now ongoing in terms of additional training, support for staff that you may feel that you need, and using appropriately that external support agency, whether that's CAMS, whether that is your educational psychologist or another mental health specialist, is something that may be a consideration at this juncture. I also think, and we're rounding up nearly now, but I do think it's important to remember you as the adults involved in creating a support plan for yourself, because whilst we as the adults are supporting children and young people who are bereaved, who've experienced grief and loss, many of us will also have experienced that ourselves, and it's vital that we work through and acknowledge our own losses too. And it's also vital that as a practitioner in a school context, or even like me as a psychologist coming in, that you know that you're in a position, you're in a place emotionally to be able to support children and young people through this. And if your grief is very new to you, or if your grief is complex, then I would suggest you need to take a step back and encourage other members of the staff team to take on this particular role. We need to understand that we too will re-experience sad memories and responses. We need the time to talk, to have our feelings validated. We need to engage in appropriate self-care, give ourselves time and space to grieve, and also looking at our self-team. There will be members of the staff team who have lost someone and have not coped particularly well because it was traumatic for them. So we need to be very, very cognizant of that, aware of that. We need to develop our own coping techniques, our own support network, and we need to think about our own way of sharing those memorials, remembering, commemorating as well. So the support plan is not just for the child or young person. If you are being tasked with looking after bereaved children, it's for you too. So just some final questions that you may want to reflect on. Just thinking about what has been helpful from this, and I'm really hoping that you've taken away something that maybe you can think about that might change your practice, or maybe just a question to yourself about what you're going to do next and what support you might need additionally to this. And I think that is important because there will be other areas that we need to think about. Maybe we need more of an understanding of this area. Maybe we need more experience, knowledge and understanding as to how to support children. What are our reintegration processes, for example? That's very, very important. How do we work with families? What is it that you can use? There may be something you can use directly right now. There may be something that you can specifically think, yes, that's a key tool or strategy, or that's a lovely activity I could use with a young person I'm currently working with. But ultimately, it's about how you develop your systems to support the school community at 3 levels, really, both for those individuals, our more vulnerable children in particular, groups of children, and how we educate, how we encourage children to think about grief and loss, and what is your policy here? Is this on your curriculum? It should be, in my view. And whole school context, what is our policy for nurturing staff, for nurturing our children too in this particular area? There's some references and resources which I hope you can use, and thank you very much for listening to me, and I know it's now time to take the survey.
Thank you so much, Tina. I can't begin to say how valuable that was for me as a practitioner. I'm sure for everybody here this evening too. There are many observations that I made, but I think it was so comprehensive, but you also gave a lot of really practical strategies, which I'm sure people will value. And although there is a pedagogy and practice follow-up session, I think people really do come to these sessions hoping to get some useful things that they can immediately take back, and you have definitely given that. It's been so useful. I think the policy level that you mentioned is so critical as well, that we really need to have this embedded. in-school policies so that they're not on the back foot if something happens. And also the thing that really struck me is that how you made it so clear that we grieve about things much more than death. And that almost definition really of grief is we grieve because of things that we remember things when they were better, is such a valuable takeaway. I think that everybody here will be able to have something that resonates with that. So thank you so much. We're just going to take a moment now for the first survey, which I believe is in the webinar chat area. So we just like to take a moment for people to just reflect, have a little think about how useful it's been for them. We've already got a lot of questions coming in. So we're just going to give you a moment before we start giving those questions to Tina, and just have a little reflect and chance to start filling in the evaluation as well and the feedback of that. Feedback, of course, is really important to us at ACAM and Life Education, because based on your feedback, we can shape future events. So we really do value that. And Matt is launching that for us. I will say as well, Tina, that Joe and I have been looking at the questions as they've been coming in, and there are some really valuable and potent ones, and not very much crossover actually. So we've got quite a few to get through. So that's great. Some really valuable ones to I'm sure that other people will value, even though they are personal to the individuals that posted them. So I think we'll get going with the questions now. And the first one that we had was about a child at school who recently been bereaved, had a parent that died, and they're displaying anger at home, but they're not showing this at school at all. They're covering it up a lot. And the teacher feels a professional conflict here, because the teacher doesn't want to push the child, make them talk, but as you said, talking is the key. But the teacher does want to support this child and fulfill the professional duty of care, of course. How does the teacher get that balance when the child says that they're fine and doesn't respond and open up when those opportunities are given to them, which they are?
I think it's really important to remember that the child at home is displaying that grief clearly, and maybe part of their coping mechanism at this current time is to cover that because they want it to be normal. When I was saying earlier about you kind of look back and you think what it was like before, and I just wish it was the same again, etc. And I think in a way we can get a bit too focused on they need to speak to me, when actually if someone is not speaking to you and they're saying they're fine, it's usually because they're not in the right place yet to have that conversation with you. And that's not something about you personally as the teacher or the carer in the school context not being nurturing enough. I think it's about they just want to keep that space free of the grief, free of the loss, because it makes them feel safe in that way. So I think it's really, really important not to push, but just to actually maybe at some junctures you might want to do some creative artwork. I think it's much safer when we don't talk sometimes. I do a lot of kind of working alongside children. So a lot of the stuff I do in terms of talking to kids, we don't call it therapy, we call it car talk. So if you're driving and you've got someone sitting next to you and you're not actually in each other's vision, because sometimes that's just too overwhelming. I think, you know, it's about time. As I said earlier, that one of the key pieces of advice in this was about giving it time and not being frightened. This is the way that the child is at the moment. If this continues for too many weeks, then obviously you can kind of sort of come back and unpick that slightly and maybe do some more activities, but actually give them a quiet space where you're actually not just forcing them to talk, but you're just doing something more generally therapeutic. And that is about being creative, using the creative arts, using music, using painting, let's talk about our feelings, let's discuss this, because it may start to come out through that as opposed to this direct conversation. It's about what I feel safe with, you know. And if after a few weeks it's not shifting it and you're worried that the child is getting stuck here, then I think you can have those conversations about, you know, I've noticed that, I'm curious that, just gently. If the child says, no, I'm fine, okay, we'll leave it. Do you know, you know, I'm wondering how you are. I'm wondering what's going on for you. I mean, it's that curious conversation starters, which I think can be really, really helpful without kind of putting them on the spot and saying, right, we're going to sit in a room together and you're going to tell me how you're experiencing your grief, basically.
Yes.
You know, and I think any practitioner worth their salt would know that that was wrong. But I think this is, you know, it's a tricky one, because there is a balance between a child getting stuck and you're worried that they're just in total denial for too long. But at the same time, we all grieve at a different pace, in a slightly different way, you know, and this may be their coping mechanism at the moment, and it's getting them into school. And I think as well, maintaining contact with the parent.
Yes.
I mean, that to me is crucial, because it may be that through that anger, they may begin to talk to the parent who's left. I mean, and that might be difficult for them. So it may be the routing may be through the parent, and it may be around actually talking to the parent, supporting the parent more, so that the parent feels more equipped to share some of their grief if they're in a position to, and to normalise it for their own child, and to start doing some of the stuff I was talking about in this presentation in terms of the memory work, the remembering, the celebrating over time. So it's not easy, but I think it's about not being fearful of this, because at the moment this is this child's coping mechanism for now. As long as you keep on top of it, you keep observant, and you keep in touch with the existing carers.
Exactly. So it's keeping communication and talking, not necessarily to the child, but keeping that communication over via the parent. That triangulation is really valuable. And creative therapies are there, you know, they have value, and that's why we need them. Absolutely. So tremendously great. Thank you, Tina. One teacher had asked how we support a non-verbal child.
Well, I think the non-verbal child, the child that is not actually communicating, whether that is because of cognitive deficit, whatever it is, you're going to be using creative approaches again. You're going to be using the physical approaches, the sensitivity, the cuddling, the nurturing, and actually the visuals and visual memories, visual reminders, etc. And I think anyone who works in severe learning difficulties contexts will talk about that and how they do it pictorially, through pictures, through memories, and actually normalizing this for the child through those visual images, through those visual means as well. And again, the creative therapists have to come into play here, and children who are non-verbal normally would be accessing that kind of support. They didn't, sadly, in the pandemic. And I think this was a huge issue in terms of how children regressed, and may have impacted quite significantly on children's loss and experience of loss at the time, who were non-verbal, who weren't getting the opportunities to have that therapeutic input. So I hope that goes some way.
Yes, thank you. Thanks, Tina. Yeah. Somebody asked about conversation starters, which I think you actually covered in the previous question, where you talked about different ways of talking. The phrase you used was particularly about, it's just, oh no, it's really valuable as well.
Curious conversations.
That's it, curious conversations, which we've had at previous ACAM discussions actually about trauma and so on. So just keeping it all very sort of bit open-ended, really, rather than
open-ended, and not kind of in your face. It's got to be very gentle, very, very gentle. And I think as well, you know, the conversation starters, sometimes I think it's not always wise to say, I'm curious about how you're feeling. Yes. It works, but sometimes it's, if the child isn't at the place to talk yet, it's sometimes easier to say something like, I'm really curious. It's really difficult when people lose their loved ones. What do you think people feel? What do you think other people experience? Stories, hugely important for that. You know, reading the story, because immediately you're not pushing it onto the child. You're actually saying, let's look, you know, Tom in this story has lost his granddad. Oh gosh, what do you think he feels? You know, and that actually that makes it safer to explore those feelings.
So it's that projecting.
Yeah, Yeah,
Yeah,
absolutely.
and often I imagine using puppets perhaps for younger children would be a tool that you could use as well as books for that.
Absolutely, always. And I
Mhm.
mean, I think if you any early years practitioner will probably have a
Mhm.
stash of them.
Yeah.
And I think that, you know, I remember years and years ago when we first were developing all the STEELS program, and I did a wee bit of writing for that in schools, and we did a lot on children's emotional vocabulary, how to get that going, and huge amount of work with puppets, talking about how people feel and the puppets
Mm,
having a fight or an argument, and then, you know, problem solving around that. So it's not it's not put onto the child. So yeah, really
mm,
powerful.
mhm. And in common with many areas of PSHE, again, sort of drugs education or other aspects of health education and mental well-being. So it's such valuable tools.
Yeah.
What about one teacher or person has asked how to prepare a child when one of their friends in the class is dying, or not even in the class, but is dying of a terminal illness?
Right. I just actually encountered this in a school just before the pandemic, a local school here where the little boy was dying, had cancer, and I think I think for the teacher, this is something that I would always say, please don't try and do this on your own. This was a class teacher, this child was 7. And I think for me, preparing the children is crucial. But again, got to be really careful. It has to be done in conjunction with the family.
Mm,
There were 2 cases that I had to work on, and one of the cases like this, the parents did not want the other children to know. They didn't want the other parents to know. They didn't want it being paraded on social media. And sadly, that is a significant issue now. But for me, when the parents did want the children to know and they were trying to prepare them, they made use of their child and educational psychologist, who came into work alongside the teacher and led a session around what was going on, talking about death, talking about what was wrong, what was going to happen, and then actually getting the children to write lovely memories of the child, sending nice letters, etc., when the child was in hospital. It was a long process, and it was over a couple of months, this piece of work. And I think that that is very, very important, that you don't do this on your own if you are a classroom or a form tutor practitioner, that this is something that you get that additional support for. But again, I was very clear in this presentation about not telling fibs. Don't lie to children. Don't just, because it's more frightening when you don't know. When
mm,
I know what's going to happen, at least I know that there's something I might be able to do. I might be able
mm,
to send those letters out. We might be able to think about how we're going to commemorate this child after their death, etc., etc. And I think for the staff team as well, equally as important, there will be teachers that got very, very close to that child. But also, conversely to this, there may be issues in the class group where 1 or 2 children did not actually like the child. So again, you've got to factor that
mm,
into your thinking when you're approaching this as a whole class session. And it may be
mhm,
that you do it in smaller groups. The head teacher maybe will also access the EP to actually do a whole school assembly on this too. But the preparation, the talking, the communication, very sincere, but you don't want myths
mhm,
perpetuated. And when
yeah,
someone knows the facts, and I think this is really, really important. Oh, he got run over by a bus and his dad stabbed him, and you know, I've heard some awful things, and then it gets onto the internet, and
mhm,
that's
mhm,
hugely traumatic for the family and everyone else. And there's a key role for school-based staff here in terms of ensuring that the facts are known. And we
yes,
need to fact check, like we do, you know, the war in Ukraine at the moment, what's really
mm,
being presented to us and people in other countries. And I think this is exactly the same for this particular process.
thank you. And of course, the added complexities there, as you pointed out, of peer dynamics and how children get on with each other, and
Yeah,
the huge sort of melting pot of that. So yeah,
yeah,
it's
yeah.
a very difficult situation. There are a few questions about how to talk to send children, particularly with ASD, where they have maybe a relative with a terminal illness, maybe a grandparent or something, or just more in general, talking with SEND and particularly ASD children. I know you talked a little bit about this during
Yeah,
this
yeah.
session.
For me, it's about being very literal, and it's also about the time factor, and it's also about reinforcement and making this very, very clear, and making sure that the child really understands what is going on, what the current situation is, and what is going to happen. Or if they've lost that grandparent, what did happen? So that, again, they don't get into this kind of muddle around fact, fiction. That's really important, because when we get the anxiety levels increasing, it's generally because I wasn't given the facts, I didn't know, and they need to feel safe and trusted. And it may be that they're going to ask again and again and again. And I think that that repetition is something that we have to meet, that we mustn't dismiss. That is absolutely vital. I mean, I had one parent once say to me, I've told him I don't know how many times what happened to Gran, you know, but actually he keeps coming. And I'm saying, but because he needs to know again, needs to hear it again. And also, I think there's something about the preparation in terms of making sure before someone has died that they have conversations with them, that they understand what death is, that what is going to happen. And they also have the chance to share memories, to make up that memory box, to start thinking about that special person. And again, taking the time to do that is absolutely essential. And I don't see that someone with ASD is going to have a particularly different approach. I just think that it's going to be longer, it's going to take more reinforcement, and it's going to need more routine. And the patience level in terms of answering those repeated questions very often is what makes or can make a real difference too. I hope I'm sure there are lots of other things.
Yeah, and obviously that's going to be harder for a parent when if they are themselves coming to terms with a loss as well. As you said before, that must really amplify that particular challenge.
Yeah, and I think that's again why working with school-based staff is important, because you know, clearly within a school, if the mum or dad or whoever's left, the carer, is communicating that with school-based staff, then of course their approach can be different too, and they can take that additional time. And I think there is something really important about not losing sight of some children are going to need more. And, you know, the moment that we kind of say, well, it's a one size fits all, we do some grief education, we'll give children 3 or 4 weeks with the counsellor. Some children are going to need more, and they're going to need more reinforcement and more help and support.
Thank you. Yeah, very important. This is quite unusual, but it may not be unusual. You may have heard this many times, Tina. A child in year 5 who's lost a parent but doesn't want anybody to know, even a year on, anybody in the school, doesn't want the other teachers to know. So they're trying to keep the lid on it.
Yeah, and you know, if we're listening to the voice of the child and truly listening, that's what this child wants at the moment. It won't always be the case, but there'll be reasons for that. What I would say is, as long as that child has some access to some support in some context, then that is what's, you know, because obviously they're saying, I don't want people to know, and they've every right to do that. They don't want to be treated differently. They don't want to focus on it. It's too painful. They just want to go in and get on as normal. Now, for some, you might say, well, that's burying it all. Well, it would be if they didn't also have some support. So I say, alongside that, please ensure that that child has someone to talk to, so that they do have the opportunity to talk about, to process, to work through their big, scary, angry, depressed feelings, whatever they are. They need to have that access. But actually pushing them into divulging this in a school context, there'll be very valid reasons for that child that matter to them significantly as to why they don't want other people to know. And we might not always know what they are, but we really do have to respect that, I think. What you don't want is for everyone to know, and that child starts to say, well, actually, I don't want to go back to school. I don't want to be there. Now you've done that. And, you know, emotionally based school avoidance, as we know, is so prevalent at the moment. And these children are very much at risk of that.
And if that was, because in this particular instance, it's been for a year, over a year, at what point do you think this has stuck a child and you need to do something else? Or I guess what you've said already is the thing to
well,
make
I think
sure
they're, I think they're stuck. I think they're stuck now. I think they need support now.
So that support needs to be perhaps ramped up, so that somehow with parents or
yes, absolutely,
looking after that. Yeah. And a really interesting question we had about delayed grief, and this person was asking about sort of cognitive ability of children. Say if a child is very young, maybe 3, and the concept of death isn't very clear, but they maybe lose a parent. Could they then suddenly grieve for that parent maybe 2 or 3 years later, when the concept of death kind of becomes more clear to them cognitively?
Yes, absolutely. And maybe 10 years later. I think this is really important to remember, is, you know, when children understanding is less developed. What is not is their emotional response. And I think we forget that in a context of a home where there is grief and loss and people have lost someone they love, whether or not they can articulate that, they certainly can absorb the emotions of the context. So I had a boy say to me once in the SEBD school, the FDMH school as now, that he remembers his granny dying and he got this real sense of pain and loss from it. And I think he was about 13 when I worked with him. And one of the other teachers in the school said to me, well, he can't possibly remember that because he was only like 12 months old. He was only a little boy, you know. And I said, well, no, but what he does remember is the pain, and he remembers the depression that his mother sank into because that interrupted his bonds with his mother. So I think there is something about recognizing that, yes, of course they can, and it can be delayed, just as we get anticipatory grief, where we start grieving very, very early on. So some children or adults, in my case personally, from my mother who died last year, there was a year after the diagnosis where we knew what was going to happen. So we actually started grieving at that point. And I think that happens with children too. So you can have the delay and also the anticipatory grief that children, young people and adults will experience.
Thank you. Yeah, thank you. One question here about a student that's in year 10 and EBSA. She's been given a place as a nurturing provision, but the school can't actually get her to go. They can't get her to attend. They want to encourage her to go to this and to attend the centre. She lost her dad to suicide just last September, so relatively recently.
Yeah.
Any sort of thoughts on that quite specific question, Tina?
Well, in my view, I would absolutely say, can people please go to her? Can people please go to her to give her support? This is going to be a very gradual process. I did a session yesterday on EBSA, and children that have experienced this level of trauma and this level of loss can't possibly just be expected to go back in, even if it's to a more specialist provision, such as a nurture group. It's going to have to be much more staggered and planned, and they've got to start working with her in the place where she currently feels safest. So this is about the kind of outreach to get the inreach going subsequent. And it's not something that I think can be done very, very quickly. You can't just push her into that context. And I confess, I mean, that is so raw, and it's still so, well, I mean, how many months is it? You know,
yeah, it's not even 6 months, is it?
No. So, and I think that's, you don't want to do more damage, and I absolutely think this would. We've got to be much more flexible and nuanced about how we support some of our children, young people, when this has happened, this level of trauma has happened to them and to their families. Sorry, it's not to be more helpful, but I can't give a kind of yes to that. Sorry.
Now let's go to a much more general question. I'm sure lots of teachers this will resonate. The loss of a pet. And for some children, this is much harder than for others. And obviously, this is something that is a helpful part of learning about grief and bereavement.
Yeah. Very often with younger children, this is a way in to start talking about death, obviously, because many of us will lose a pet. And I also think as well that you have to remember, and I said earlier, what's grief worthy? Yes, and that is exactly. Grief worthy. It's a loss. It's significant. And for me, as a 6-year-old child, it's the world has collapsed, you know.
Yes.
And that pain. And I think, you know, we mustn't minimize it. We mustn't, you know, at all. So all the same processes for a pet, the loss of a pet, an animal that's something that you have loved. I mean, you know, George the dog actually becomes part of the family. So it's like losing a sibling for a child. So we must go through similar processes and give them the time. Rituals, okay, the memories, or the photos of George, my Georgie book, you know, burying in the garden, whatever we do, we mustn't minimize it. It's just as significant and traumatic for a child or young person.
Thank you, Tina. We've come to the end of the Q&A now. There are more questions. All of them were so valuable. It was quite hard to sort through them, but we hope that we've answered as many as we can and that they've been as useful for most people.
Find out more about becoming an ACAM member And to be part of the advancement of child and adolescent mental health, visit www.acamh.org.